High surgical site infections in coronary artery bypass grafts were one of the top concerns identified in the Infection Control Risk Assessment in 2013. One of the 4 components of care in the prevention of surgical site infections is the appropriate use of prophylactic antibiotics. Through analysis and process changes, the team was able to effect significant improvement in antibiotic prophylaxis compliance. Brachytherapy, or BT, is an interventional radio-oncological procedure which is an essential treatment component for cervical cancer. Common and conventional methods of cervix cancer BT are still based on a 2D system of points, defined on pelvic radiographs or CT images. This project aimed to reform our BT practice in the Department of Radiation Oncology, NCCCR, with the implementation of MR IGA-BT in order to improve clinical outcomes. The goal of the project was to build up a world-class bariatric and metabolic surgery service at HMC that will meet the progressively increasing demand for this type of surgery as morbid obesity and type 2 diabetes have become endemic in Qatar. Through efficient clinical pathways and rapid turnover, the team has seen significant increases in patient volume, while morbidity and mortality rates fall below international reported rates. The goal of implementing the first pharmacist-managed anticoagulation clinic in Qatar is to offer a standardized process for the individualized assessment, adjustment, monitoring, and education of patients receiving warfarin and other anticoagulants on an outpatient basis by a clinical pharmacist. This service was launched in May 2013, and the protocols were accepted by Joint Commission International Consultants in March 2014. The Hamad General Hospital Art and Healing Programme was developed for long-term paediatric patients to promote the process of healing through art. Through the Art and Healing Programme and partnerships with Disney Worldwide, Sports Entertainment Solutions, and the Museum of Islamic Arts, the programme has been able to help paediatric patients live a fuller and happier life during their stay in the hospital. The primary goal of this programme was to empower parents in their new role by providing relevant information and coping strategies, as dealing with a premature child can be a very emotional experience. Through this programme, the team was able to enrich the infant-parent interaction and empower parents to be viable partners in promoting growth of their NICU infant. The Pediatric Cardiac International Patient Programme was created to enable children from war-torn or poverty-stricken countries to receive desperately needed treatment that would otherwise not be available to them. Through the concerted effort of the team and internationally coordinated efforts, the programme has performed 51 cardiac surgeries entirely funded by charitable organisations. The Paediatric Home TPN service is a family-centred, child-focused and transdisciplinary service that was introduced at HMC to facilitate the discharge of children with intestinal failure. This was accomplished by training the caregivers to do the TPN connection and care at home, thereby allowing the children to return to their families. The primary goal of this project was to make the Al Wakra outpatient pharmacy one of the most automated hospital pharmacies in Qatar and the Middle East. With the introduction of a dispensing robot, queue management system, revised workflow, and a medication barcode system, the pharmacy has reduced waiting times, improved stock management, and increased patient satisfaction. The goal of this program was to set up a one-stop shop for uro-oncology in order to improve patient experience, involve patients in their diagnoses, reduce waiting times for outpatient procedures in uro-oncology, and create a service model that meets the organisational strategy. Implementation of this program has led to reduced waiting times for patients and contributed to earlier detection of certain types of cancer. As emergency medical dispatch becomes increasingly complex in the state of Qatar due to continuous development and increasing population, ambulance service dispatchers need relevant and consistent training to perform their duties. The Medical Priority Dispatch System helped train our dispatchers through the implementation of a response matrix and development of permanent quality improvement processes. The specific aim of this project was to reduce elective surgical cancellations and create an improved patient experience. This goal was achieved by redesigning the elective surgical pathways and creating a central scheduling and booking system for surgery patients. The primary goal of the HMC Venous Thromboembolism Prevention Project is to risk stratify all HMC patients in scope for VTE and to improve thromboprophylaxis where appropriate. A year after implementation, the VTE protocol was found to be in the medical record in 98% of patients across all HMC units. Risk assessment was accurately completed in 96% of patients, and appropriate prophylaxis was ordered in 94% of patients where indicated. In this project, an outpatient facility for general medicine and medicine subspecialties was designed to improve the patient experience through enhanced pathways and service delivery. Implemented within the existing facility, the result is a one-stop shop approach that combines consultation, laboratory, pharmacy, registration, nursing and patient education in the same location. In September 2013, a repatriation committee was formed to ensure the safe transfer of patients back to their home country. These patients are medically stable, but due to permanent disability as a result of illness or injury, they are occupying beds across HMC hospitals. The multidisciplinary committee worked with embassies, sponsors and other agencies to safely return patients back to their families in their country of origin. The result of teamwork from many departments across HMC, the skilled nursing facility is a home away from home for long-term adult patients. The facility is designed to make patients feel relaxed and at home, and offers patient-centered care with using state-of-the-art medical and rehabilitation equipment. Patient satisfaction at this facility scored at 75%, with no falls for the past year and no incidents of facility-acquired pressure ulcers. The Child Development Centre at Rumaila Hospital is the main referral centre in Qatar for children with developmental disorders, including autism spectrum disorder. Through international partnerships with Holland Bloorview Rehab Hospital in Toronto, Canada, and Sick Kids Hospital in Ontario, Canada, the service has developed to provide improved diagnosis, intervention, family education, and community awareness. The HR Customer Service Project was developed to meet the increasing demands for HR services such as housing, immigration, pay and benefits across all of HMC. Project implementation included recruitment and training of professional customer services staff, creation of a customer care centre to act as a one-stop shop for all HR services, and installation of a modern queuing system and comfortable waiting areas. The Lighting Power Saving for Better Environment project is an innovative green initiative in which the lighting systems of the Women's Hospital were engineered to reducing illumination at night, thereby providing a better ambience for rest while also signalling to visitors that visiting hours had ended. In addition to significant cost savings, the environmental impact has been a reduction in carbon dioxide emissions of approximately 3,500 kilograms per month. The SOGA program was developed to increase HMC staff satisfaction by negotiating employee discounts with retailers, restaurants and hotels across Qatar and internationally. With hundreds of agreements in place, HMC staff are now entitled to discounts and special offers for such items as electronics and entertainment, home appliances, gifts, flowers, health and beauty services, education, airfare and much more. The Universal Teleconferencing System project was developed to transform existing computer terminals into a reliable, user-friendly teleconferencing system. Implementation of this system has reduced the need to travel between physical sites within Doha, thereby saving upward of 30 hours per week of physician travel time and bringing attendance of residents and faculty in meetings to optimum levels. The World of Welcome programme was designed to ensure all staff have the same foundation of knowledge regarding hospitality in order to create a hospitable healthcare environment for all our patients. A highly interactive programme, the training includes Q&A sessions, discussions, exercises, syndicate works and role plays. Since the initial rollout in November 2011, approximately 5,000 staff have attended the training, representing almost 25% of HMC employees, with an overall course satisfaction rate of 94%. The Baby Friendly initiative is based on a global accreditation program of UNICEF and the World Health Organization, and is designed to support breastfeeding and parent-infant relationships by working to improve standards of care. The Women's Hospital has implemented the Baby Friendly initiative and created a supportive hospital environment with motivated, educated and skilled staff where a breastfeeding culture is the norm. After 2 years of intensive preparation, rigorous evaluation and generous support from the academic health system, HMC became accredited by the American Nursing Credentialing Center, or ANCC, to provide continuing nursing education. This marks a significant achievement, as HMC is the first healthcare organisation in the GCC and only the third in the Middle East to be awarded ANCC accreditation. The goal of this project was to empower midwives to repair episiotomies that are encountered during childbirth. A training program was formulated and implemented in June 2013 that included theory, simulation, and training on real-life patients under supervision. As of June 2014, 68% of midwives in the labour wards have been trained to suture independently, resulting in reduced waiting times and improved patient satisfaction. The Leadership for Change project was developed to help strengthen the leadership and management capacity of nursing in Qatar, with an emphasis on helping Qatari nurses to develop the correct skills in order to lead Qatar's health system in the future. Through cooperation with the World Health Organization, the Supreme Council of Health, and the International Council of Nurses, 13 Qatari nurses graduated from the Leadership for Change program in 2014. The goal of the research projects involved was to further the understanding of genetic components of inherited diseases pertinent to the population of Qatar. Several original studies were translated into clinical care as a result of the research, and the team led 2 clinical drug trials for MPS type IV. The research has been cited in numerous publications with impact factors up to 31. Q-stent is the name given to the first cardiac surgical instrument to be developed in Qatar. The project pertains to a team that designed, developed and implemented into clinical usage a novel device used in adult and pediatric cardiac surgery. This effort has led to the very first intellectual property filing in the GCC by HMC, and the clinical experience with the successful usage of this device has been presented in international conferences. This research project observed and confirmed that administration of oral dexamethasone reduces disease severity and decreases hospital stay for pediatric patients presenting upper respiratory tract infection. The research was performed in collaboration with several international universities and has been published in Pediatrics Journal. The first integrated clinical research unit in trauma surgery within Qatar was established in 2011, with a vision to improve patient care through clinical research. Key achievements of the unit have included the establishment of a registry database for trauma, participation in international multi-center trials, and spurring the number of peer-reviewed publications, both domestically and internationally, of HMC.